In part 2 of this month's health check, we're talking with WVU Medicine Camden Clark family medicine physician Dr. Daniel Shank again about staying healthy as we age and how primary care supports long-term wellness. Dr. Shank, thank you for joining us again this week.
Absolutely. Happy to be here.
Absolutely. So the first question that I have for you is, once patients establish that connection with their primary care, how does that partnership evolve as they get older?
So I believe it becomes a lot more collaborative. So, early on in the patient's age and things, they really focus more on short-term things, right?
Right.
You're there for your annual because your insurance tells you to, or you have sinus infection, UTI, something, your problem, we take care of the problem, and then you're gone. So then as patients age though, that role of the primary care really becomes important, I think, because we know that patient, know what their goals are, know their family generally, these kinds of things, and are able to kind of really help them in that long-term function in terms of kind of mobility, maintaining independence, adjusting medications and goals of certain diagnoses and management for their goals, really.
Right, and so my next question leads into this. For those living with chronic conditions like diabetes or heart disease, what role does regular follow-up play in keeping those conditions, well managed?
Yeah, so we can continue to try to prevent complications by making small adjustments over time instead of just reacting to disease or major symptoms whenever they pop up. So, it's certainly more of a goal to stay on top of things. What we don't always like is someone doesn't want to commit to taking care of their cholesterol numbers, their blood pressure, their blood sugar, all these things. Then they come in after having a heart attack and now they're on 5 medications, right? So certainly a lifestyle change for them, and that can be pretty difficult. So coming in, staying on top of things, making small adjustments over time to prevent long-term complications.
Absolutely. And so we've been hearing a lot about longevity and living not just longer, but healthier. From your experience, what are some of the biggest keys to, healthily age?
Consistency is key, right?
Consistency is always key in anything.
Consistency is always key, right? So, but it's the hardest thing to do.
Right.
But so focusing on nutrition, movement or exercise, high quality sleep, stress management, these kinds of things are certainly good, but being consistent with that whole food-based diet, right? Having appropriate portion size.
Right.
I tell people all the time, you can look up a hand portion guide for your protein for this and that, but that's for your one plate, right? Not per plate.
Oh, it's only,
one plate, not per plate.
I think I've got to learn that. I might have to hang out with you over.
Hey, come on over.
I was going to say, because I probably need to learn that one myself.
Absolutely. So sort of simple things like that, movement somehow, some way, keep moving, right? It doesn't have to be 2 hours at a gym. You can split it up, 15 minutes twice a day is 30 minutes, right? So however you can keep moving, focusing on quality sleep, a lot of these things that are the real drivers of long-term health.
Absolutely. And so a lot of these things are kind of, it sounds like, daily routines. Let's talk about that specifically. What are some small and practical habits that can maybe make the biggest difference in controlling your blood sugar, improving heart health, and maintaining, just general energy, motivation?
Yep. I feel like people get hung up on perfection, right? They won't start something unless it can be the perfect situation, perfect timing.
Absolutely.
Yeah, it's difficult, right?
I'm a perfectionist, so if it's not perfect, then I'm out.
Yeah, I'm not even going to start it. So just getting started with some of those things, and especially, like I said, 30 minutes of moderate intensive exercise, 5 days a week gets you that 150 minutes recommendation. But that's kind of like your minimal, okay? If you can't do 30 at a time, like I said, do 15 in the morning, 15 in the evening, however you can get there, and then try to excel from there. Focusing on quality protein sources, ideally more whole food based things instead of these easy pre-mixed
the
processed
foods,
drinks and stuff, right? These ultra processed protein drinks people have, so try to make it whole food based. And really the most immediate impact you can do is reduce your sugar and carbohydrate intake. Easiest thing to make the most significant impact early on, but more long term, and especially in terms of longevity, a lot of evidence for fiber and increase in fiber intake. The average American has like 13 grams of fiber in a day. Just taking that above 20 grams significantly reduces all-cause mortality.
Oh, wow.
So aim for 30, 35 grams of fiber is the best long-term thing you can do. Try to keep your protein consistent through the middle of that, and then just cut the sugar out as much as possible.
Absolutely. So now I want to turn our attention to things like sleep, nutrition, and stress management. In the bigger picture, how can you, get preventative care or prevent yourself from letting those things let your health get out of hand?
Yeah, so I would say those are the foundational things. So the simplest things to do and talk about, and you may sit up here and mention, but until you're focused on committing to improving each one of those, then all the best supplements, all the best medications, all the best biohacking techniques that are very exciting and very effective,
right?
They just aren't nearly as effective if you don't have that foundation in place.
Absolutely.
So I know I sound like a broken record here, but it is that important. And then you can go on to start introducing, I have all these things in place, my numbers are looking great, I'm feeling great. What supplements can I add to supplement my positive health, or what other things can I do to really excel into that more longevity side of things, quality of life, life to years, that kind of stuff.
Right. And so finally, one last question for you before I let you go. What's your best advice to viewers about taking charge of their own health, no matter what their age is?
Yeah, so, really the easiest thing is start with one change and then build on those small wins, kind of reflect a little bit and ask yourself, what's the one thing I can do to make the strongest effect more immediately. So once you do that, start building on it, let that become a habit, then add in the next, and keep going until you have these consistent positive habits across various aspects of life. Work with nutrition, then work on exercise, work on sleep. All these are very important. And then again, just don't wait for perfect timing, because it'll never be the perfect time. Just start doing, keep building, and then just stay positive through it all.
Absolutely. Keep that positive momentum and just
Absolutely.
keep pushing. Dr. Shank, thank you for sitting down with us the last 2 weeks and sharing your wealth of knowledge on this topic and giving some great tips to our viewers to improve their health over their lifetime.
Absolutely. Thank you for having me.
Of course. When we return Mid-Ohio Valley, we'll have one last look at your forecast. Stay with us.